My name is Dries Ricey. I'm an interventional radiologist, and I also serve as the Division Chief of Interventional Radiology at UK Healthcare. A lot of folks ask me, what is interventional radiology? And sometimes those folks are actually doctors who still don't have very clear what interventional radiology is. I personally would define it as a miracle, a God-given miracle to humanity. It is the ability to perform surgeries without doing the surgery itself. Every year there are more procedures that you can do through interventional radiology. Every year there are more specialists who develop an interventional practice, such as interventional pulmonology, interventional GI. Everybody now has realized how miraculous it is to be able to treat patients without actually making them undergo major surgery. Me personally, I see patients who might suffer from liver disease, liver failure, certain types of cancer that go to the liver, either liver cancer or colorectal cancer, or patients that may need local radiation to the liver delivered through the bloodstream. I focus a lot on patients that might suffer from bleeding, either from trauma, or might come here after a car wreck and might need an urgent intervention. Another thing that I specialize in is women's health, mostly patients who have very disabling periods, who might have fibroids. And we perform a procedure here at UK Healthcare in a multidisciplinary fashion in order to salvage the uterus and keep young, healthy females away from going under the knife, and they conserve their ability to continue to bear children. Being in an academic center gives you has many perks. One of them is working in a strong multidisciplinary fashion. So you have a lot of other folks that support your decisions, that double check your decisions, and ensure that we are able to come up with the best plan for the patient. Not simply my plan, it's the plan that's been built across multiple other specialists. I hail from a rather humble beginnings. From mostly my ancestry is farmers who had very little access to healthcare, who suffered from a lot of chronic illness. And I've always looked at them as with the hope that I'll be one day able to treat them. And I continue that mission with my patients now. I look at my patients as my family, and I make decisions based on their values and based on me looking at them as my own family members. That's my philosophy. It's very simple, it works, and it allows me to connect with patients, it is a privilege. That sense of being useful to people is irreplaceable. It allows you to wake up in the morning. It allows you to go on with a busy 20-hour shift and feel very good about yourself, feel like you do have a role in this life, that you are valued, and that you're really making a difference, which is really what all human beings we strive for, is to really make a difference.